Common symptoms of a thyroid disorder include fatigue, weight gain, thinning hair, cognitive problems such as brain fog or poor focus, insomnia, depression, anxiety, or feeling overly emotional, chronic pain. In fact, many patients diagnosed with fibromyalgia actually suffer with undiagnosed or poorly managed thyroid disorders, and just generally feeling terrible. These symptoms are not just minor annoyances. Women and men with thyroid disorders feel terrible physically, and this impacts so many areas of their lives, from relationships with spouses and children, to productivity at work, to the ability to exercise and recover well. Conventional medicine's approach is to medicate thyroid patients with a synthetic thyroid hormone replacement, but this approach does not address the underlying reason someone isn't producing enough thyroid hormones in the first place. To understand a functional approach to thyroid disorders, we need a quick lesson in thyroid metabolism. The hypothalamus sends thyrotropin-releasing hormone to the pituitary to stimulate the release of thyroid-stimulating hormone from the thyroid. TSH then triggers the thyroid to make T4 and T3. To better understand this, let's use a metaphor. If your body is like a car, T4 is crude oil and T3 is gasoline. You can't use crude oil to fuel a car. It has to be converted to gasoline to be useful. Most of the crude oil, or T4, produced by the thyroid is sent to the liver, where a good majority of it gets converted to gasoline, or T3. A lesser amount is converted into inactive T3, and another portion is sent to the intestines. In the gut, if under the presence of good bacteria, there's even more conversion of the thyroid hormones into usable gasoline. On a practical level, what does this all mean? Here's the point to really pay attention to. If your doctor is just testing TSH, all you really know is how much your brain is telling your thyroid to do something. TSH levels don't tell you if your liver or gut is doing a good job of converting the crude oil into gasoline. And most importantly, testing and treating based on TSH levels does a huge disservice to the patient, as it makes them focus narrowly on the thyroid gland instead of taking a whole body view. If you have a thyroid disorder, you must ask yourself questions such as, how is my gut health? Is my liver detoxifying properly? Are there other hormones out of balance that are impacting thyroid metabolism? And most importantly, why do I have this problem in the first place? The most critical thing to know regarding your thyroid condition is that 90% of hypothyroid cases are due to an autoimmune disorder, mostly a condition called Hashimoto's. So simply taking drugs like Synthroid, levothyroxine, or NP-thyroid does not address the underlying problem, which is your immune system is attacking and breaking down the thyroid. This is a great segue to discussing autoimmunity in general. We are told in the conventional model, when it comes to autoimmune disorders, it only gets worse. There is no known cause other than you're just unlucky due to genetics, and that you need pharmaceutical drugs. As a result, many people end up thinking, I'm stuck with this and there's nothing I can do about it, so I have to rely on the drugs to manage my symptoms forever. So, what is an autoimmune disorder? An autoimmune condition is where the immune system sees a specific tissue as a foreign invader and starts to attack it. Here's another metaphor. Imagine you come home from work and there's a burglar in your house. You panic and call 911. Instead of sending a few police officers, the SWAT team is unleashed. The SWAT team arrests the bad guy, but in the process, they had to kick down doors, broke a lamp, and even knocked over your new flat-screen TV. They did their job, but they destroyed the house in the process. This is exactly what happens in an autoimmune condition. The immune system is in hyperdrive, attacking what they should leave alone. What causes an autoimmune condition? In the conventional mindset, the answer is often genetics. But it's important to consider what factors trigger this genetic expression. We can't control our genetics, but we can control the environment we function in. Factors like hormonal imbalances, infections, food sensitivities, gut health, and the inability to detoxify chemicals play a major role. One trigger is gut health. If your gut is damaged, you can develop intestinal permeability, more commonly known as leaky gut. Leaky gut is exactly what it sounds like.
The intestinal lining has become damaged or porous, and tiny particles can pass through. This causes an immune response and chronic inflammation and generally makes you feel miserable. Hippocrates is credited as observing that all health begins in the gut. Modern research supports this anecdote. In fact, numerous studies link gut health to overall wellness, brain health, weight, cardiac health, and even your ability to control blood sugar levels. To address an unhealthy gut, you must look to the underlying causes of the problem. You need to understand what foods or even infections trigger your gut troubles, and it's typically different for everyone. Focus on an anti-inflammatory diet, enhance circulation to the gut, minimize stress, and repair the intestines with targeted supplementation. Another common trigger of autoimmune conditions is exposure to chemicals and trouble with detoxification. Various organs have to process chemicals. Due to genetics, some chemicals are not processed effectively and will lodge themselves into tissue, triggering the immune system to overreact and attack the chemical and the tissue it has attached itself to. This goes back to why a holistic approach is so important. You must address the underlying factors of autoimmunity. Your autoimmune condition is not just about your immune system, it's about the body as a whole. If you have an autoimmune disorder, you have a 25% risk of developing more. Your body is in a state of attack and primed to break down other tissue, so simply addressing your symptoms is not enough.